It's 104.8 Channel 4. This is Fast, and today I have the privilege of speaking to Dr. Mohammed Shabbir, Specialist Emergency Medicine at NMC Royal Hospital in Sharjah. Thank you so much, Dr. Mohammed, for talking to us today.
Thank you very much for inviting me for this interview.
So I would like to talk about cardiac emergencies. What are the most common ones that you see at NMC Royal Hospital?
The commonest cardiac emergencies are heart attack, the cardiac arrhythmias, pulmonary edema, that is water filling up in the lungs because of the cardiac diseases, and congestive cardiac failure.
Now, I know there's a lot of things that we see on TV and in the media about when someone's having a heart attack, usually used as a plot for the film or the show, but I don't think a lot of people know exactly what the symptoms are of a cardiac emergency. What symptoms do you need to display before you should be worried and rush someone to hospital?
The cardiac emergencies presents with the symptoms like the central chest pain, breathlessness, palpitations, that is racing of your heart, dizziness, and lightheadedness or syncopal attack.
Wow. So do some people sometimes have a panic attack or an anxiety attack and think it's a heart attack, or do they sometimes have that and they think it's an anxiety attack, but it's actually a heart attack? Is it a cardiac emergency? Is it sometimes something that people get confused by the symptoms?
Yes, it's a possibility that it could be heart attack. So it has to be evaluated. It has to be seen by a specialist.
Okay. And what causes these kinds of cardiac emergencies?
The cardiac emergency is usually caused by the blockage of the blood vessels. There are abnormal electrical activities produced in the heart, and there is abnormal heart contractions which can cause these emergencies.
Oh, wow. And so let's say you're with your family or you're with someone and you suspect that they might be having a cardiac emergency. Obviously, the important thing to do is call the emergency services, but also what else can you do? As soon as you think someone you love is having a cardiac emergency, what do you do then?
The most common thing should be done in a cardiac emergency is make the patient calm and make him sit, not to exert, not to increase his anxiety and heart rate. Make him sit and make him comfortable, apart from calling up 998 for the emergency, for the ambulance.
So if you think someone around you is having a cardiac emergency, one of the most important things to do is to just stay calm then, because obviously it's a quite worrying situation, but you need to try and not also worry, because that's going to make them more worried.
Yes.
Okay. And how can we prevent these kinds of things from happening to begin with?
You have to have a healthy, active lifestyle with regular physical activity. We say at least 35 to 45 minutes of physical activity per week. Quit smoking if you are a smoker. Have a regular health checkup without missing it. Strict control of your chronic diseases like diabetes, hypertension, and hyperlipidemia.
Now, I think a lot of people, they sort of hear this advice, like one of the best things to do for your health, of course, is to stay active, to eat right, to quit smoking. But I think when it comes to the staying active, people are quite scared by the concept. If they're not used to exercising, they might think it's a very difficult thing for them to start. What type of things can help? Like very low impact, not very intensive workouts can people do, as you said, 40 minutes per week?
Yeah, physical activity doesn't mean that every time you need to hit a gym. You can just go for a walk, a brisk walk, a swimming, cycling, playing with the kids. That itself is a physical activity.
Yeah.
So you can do these things at least 35 to 45 minutes a week. So that should be enough to keep you active and fit.
Yeah, that's not even that long. If you just walk for 10 minutes a day, that's even more than 40 minutes a week.
You're right.
All right. Thank you so much, Dr. Mohammed of the NMC Royal Hospital in Sharjah. Dr. Mohammed Shabbir, Specialist of Emergency Medicine. Thank you so much for talking to us on 104.8 Channel 4.
Thank you for inviting me. Thank you very much. Thanks a lot.
Have a great day.
Thank you.